In 2015, an archivist in America was working on a historical digitization project. And it was a lot of things like documents from the county hall's office, written in that outlandish scrawl that we associate with times gone by, lots of legal documents, the occasional amusing news story. One in particular I really liked was about this rogue turkey that went around terrorizing the townsfolk in Thanksgiving. And with their white gloves on, this archivist, started pulling documents from the top of the pile, bringing them down, scanning them in, bringing them down and scanning them in. And they came across this one, and it had big scrawling handwriting on it. And it was this big, huge sheet, and it was all torn and worn around the edges, all yellow, just like a treasure map. And it said on it, 1889, reasons for admission into the Trans-Allegheny Lunatic Asylum. This is a bit more of an interesting piece of social history, this archivist thought. So they started reading through it, and it seemed like it was a list for why women had been put into this institution over the years. So they read on, and it was things like melancholy, death of a child, hearing voices, murder, the kind of things you would sort of expect people to be incarcerated for. And then they read on, and it was things like political excitement, overtaxing mental powers, overaction of the mind. It's always really dangerous, that. I always try and avoid that. Imaginary female trouble, female design, woman trouble, masturbation for 30 years, deranged masturbation. Actually, this masturbation was mentioned like 5 times in this document, so I'm not sure who was more obsessed with it, the women or the people who were putting the women away for it. But my favourite one was absolutely some disturbing behaviour. And I'm so glad that there was men out there to put women away for this, because it was just horrific. And that was novel reading. Absolutely disgusting, shocking behaviour. So it's really good thing that, someone put their foot down and said, let's put these women away for that. And we can laugh at this because, that was the 1800s, modern society knows better. We don't do anything like that now, do we? And then you start looking into it a bit further. During the 1940s and 50s, there was this new medical advancement. It was the darling of the scientific community. It was going to be a cure-all for mental illness. It was the lobotomy, and it was going to be scientists' way of mastering the brain for their more difficult and less understood elements of human behaviour. Unfortunately, that seemed to translate to actually being women's behaviour, because it seems like during that time, when it was at its most popular during the 40s and 50s, that actually 60 to 72% of women were the ones that the surgery was performed on. And often it was because of things like, they're too boisterous, they're too strong-willed, or they didn't conform to a Stepford wives ideal. So they were sent off to be cured with lobotomy. I even heard about this one case where this woman, she went to go see a doctor and she was being abused by her husband. And he said, well, I'll just send you to get lobotomized so you can cope with it better. And again, we think, but that's 70 years ago, Leanne, come on. It's not barely living memory, calm down, we know better now, for sure we know better now. But did you know that only 20% of the medical research that is done today is done on the female body? In a world where drugs for easing period pains, drugs aimed at increasing female libido, so the female Viagra, are all tested on men, you've got to wonder, do we really know any better? And when you think of people, if I say to you, imagine someone having a heart attack, what do you see? You see perhaps an overweight bloke, middle-aged, clutching his heart, tingly arm. But did you actually know that it's actually women who are more likely to have heart attacks than men? And their misdiagnosis has absolutely fatal consequences. So do we really know better nowadays when the top cardiologists today, when interviewed, reveal that they're unaware that women have completely different symptoms to men when it comes to having a heart attack? We might not be locking women up for novel reading these days, but we're still a very long way from understanding the female body. And it's because of underfunding, under-research, and quite frankly, a lack of interest. Women's health is classed as a niche field, and it's costing us greatly.
Now, Leanne, let's bring it to modern day. Thankfully, women aren't being locked up for novel reading. As we also have audiobooks, I love a good audiobook. Even with conditions like the menopause, something that impacts every single person with a womb, and arguably not niche, the very people who are supposed to help us don't want to deal with us. Now, I was speaking with a commissioner at my local CCG who used to be a practice manager, and she shared that the GP at the time delayed giving women the results of the blood test results to find out if they were going through the menopause. He kept putting the test results back to the back of the pile. Now, just because he just didn't want to deal with these women. Now, women tend to present to GPs quite emotional, understandably so. They just often seek solace, looking for solutions for their symptoms. They just want to be able to cope better through this change. Okay, so some people would argue that the menopause is hard to diagnose, right? You've got to test for menopause, right? Okay. Well, what about the medically induced menopause, either from cancer symptoms, cancer treatment, or hysterectomy? Because we know having a hysterectomy is guaranteed to put you into early menopause. And we should at least tell these women that by the very nature of having this drastic reduction of estrogen, which is literally applying the brakes like an emergency stop when previously you've been going at 100 miles an hour, that when this procedure happens, the menopause symptoms are deemed to be more drastic. You have worse symptoms than people that tend to go through natural menopause. I can sort of relate to this because I had 2 children. Both my labours were certainly not equal. My first labour had to be induced, and oh my goodness, it was like my contractions went from 10 to infinity. And I almost had out of good experience thinking, oh my goodness, I'm going to die. My second labour, however, was a lot more different because the body, I guess, adjusted, knew this was coming up and thought, let's get this over quick. And the body had time to adjust, much to my husband's delight, because I wasn't grabbing onto his hand for dear life and the blood supply swiftly came back. Now, surely when women go through this change, we should at least tell them how to cope. Support them through this change, perhaps. Now, one of the fondest memories, one of the last memories I had of my mum was when we went to Thailand 4 years ago. And at the age of 49, she had a hysterectomy. And I would have assumed at the time that they'd have told her, look, you've had a hysterectomy, you are likely to be having menopause a lot earlier, and your symptoms will be a bit more intense. So just to be aware of that, and should you ever have the inkling whereby, coping very well, go to your doctor, and seek some sort of treatment. But she never did. She never went to the GP, not once. Now, in her early 50s to mid 50s, she decided to look for supplements because she just kept on complaining, I'm just feeling quite tired, drained, fatigued. And I remember on many occasions, she will be sweating profusely like buckets and, just turn up the drop of a hat, whether it was hot or cold, or just literally was pouring off her, which was obvious. I knew these were hot flashes. Now, and also she didn't really sleep very well. She would be snapping at the most odd times and she would experience a bit of loss of memory, which we just thought, mum, just be mum, as you should do sometimes. Now, something didn't dawn on me in terms when we started holding the focus groups. When women were sharing their stories about, feeling quite low, quite lethargic, feeling a bit anxious, related to depression and so forth. And then the light bulb went off. I thought, my goodness. As a healthcare professional, never did I realise that those additional symptoms related to mental health could be attributed to the menopause. I had missed it. I had missed an opportunity to really be there for my mum. And I remember calling my dad and saying, Dad, and he just couldn't say a word. It was almost like it was silent. That moment was almost lasted forever. And that was really painful to realise. This is a much bigger problem. It needs solving, and we are the ones to do it. Our company, Liria Digital Health, is a health tech company like no other. We care about niche. We care about you having the knowledge to live your life to be better.
Because the fact of the matter is, for as long as women are seen as too difficult to cater for, these problems will persist. And a doctor I admired once sort of said to me, people talk about vaginas like they're really badly designed, but they're actually just really poorly maintained and there's not enough mechanics who are skilled to do so. But in a world that's as technologically advanced as we are, Some health conditions will, and some people in society will, be seen as too difficult to cater for. And we need to use technology to create bespoke experiences that fit people as individuals, not as an approximation of what a group of developers, who are often, in my experience, white middle-class males, think that life is like for these women. And when you think of like your phone, like how different is it to when you used it about 5 years ago? You expect so much more from your phone, but in return, you actually want to put less into it. So if you go to a website, for example, you're thinking of a shop, you type it in, you just want to type in the name. You don't want to just be taken to the website though. Down the right-hand side, you expect to see the shop opening times, but not just any shop opening times, not just the generic ones, the shop opening times that are local to you. You expect all that information to come to you with very, very little input. And our expectations for a bespoke experience in tech has never been stronger. And you think about how individual you make it, you change the background photo on your phone, you choose the apps, when in technology, 20 years ago, you choose what you actually want on that computer, someone else doesn't decide. And as much as you might find it creepy, you actually do quite like being advertised things you might be interested in, because it's a lot better to be advertised something you're interested in. But what strikes us at Liria Digital is that same move towards a unique and bespoke and individual experience has not materialized in health tech. And it all boils down to a lack of research, a lack of funding, and a lack of interest. And people will tell you it's because there's just too many variables, the human body, there's just too many variables. But we say that you shouldn't halt progress for the betterment of people's health just because some people are too hard to study, non-conformist, or not worthy of study, classed as niche. And we're the ones to bridge this gap. And we're more than a health tech development company. We provide people with the tools to create, innovate, and empower. We want to be the place that people come to when they have under-researched, forgotten, or unloved health conditions. Our customers are not just our customers. They're going to be our co-creators, and we're going to work collaboratively with them. They're going to create the innovative technological solutions, and we're going to give them the tools and the support to unleash this passion to innovate, create, challenge, and change the lives of millions of people, using technology in a collective endeavor, striving towards a better health for all. And we give our customers the freedom to live their lives as individuals, not as health conditions, and they lead us, not the other way around, in this journey to create unbeatable user experiences in health tech adoption for them, by them. We envision a future in Liria Digital where a trans person can come to us and tell us they've had a really difficult time managing their dosage for their hormone replacement therapies, but they've got an idea for an app, and that'll make people's lives better. It'll make people manage better. It'll make people be better. We will help them get their idea into the hands of people that need it.
We have a vision to empower people to become experts in their own health and well-being. And we'll do this through tech incubating on the behalf of others so they don't have to start from scratch and waste precious time. They'll get the health tech innovations out to the people that really need it. And we'll also create our own in-house products, like our first product, which will be the Menopause app. So how do we achieve this? By listening, by holding more focus groups, listen to stories, listen to your story. Our mantra is simple: to seek first to understand our customers, then the innovations will follow.
And it's through these stories and our lack of awareness for a condition that will inevitably impact us. Nobody tells you about the menopause when you're in your 30s. Nobody tells you in primary school. Nobody tells you these things. That's why we decided we'll focus on the menopause. And it'll be an app that fosters better collaboration and communication with GPs, because this is the area we've highlighted that needs work. We want people going through the menopause to get the help they need without ever needing to come back in 6 months when you've got more evidence. And we will empower them to understand their bodies. We will educate them so that they can act and so that they can feel less alone. Knowledge is power, and knowledge gives people the power to question, which is crucial. It gives people the power to demand better, to be experts in their own health, and to shout out when something's not right. We will give them a community to laugh, share, cry, and grow.
Now, from the various focus groups that we've done, there was one story that really stuck in my mind, and there were plenty, there were loads. It was from a 58-year-old woman. She used to be a ward sister, and she's now retired, and she said, I used to win a ward, now I feel I can't even look after myself. How sad is that? This is a huge social impact of women just leaving the workplace because simply they just feel that they can't cope. We know that health is wealth. A woman going through this change, it doesn't only impact her health, but it affects her self-confidence, her self-esteem, her self-worth, which it stops her from pursuing certain career paths. And that's not right. Not only are there social implications, there are also implications like prescribing costs, healthcare costs, because often women will present at the GP on many of occasions and they'll be sent through a batch of tests. We see this time and time again. It's almost like guesswork. What's wrong with my patient? Until the GP, who's really aware to understand, have an inkling, thinking, could this be the menopause? Could it be? And we understand that GPs can't know everything. You know, they're general practitioners, and you know, women's health is an expert area which needs to be really focused and to be made a priority. The sad thing is, obviously, women's health isn't a priority. We appreciate this knowledge is very broad, and we know that GPs with special interest, we need to make this their focus. We know that women also from ethnic minorities and low socioeconomic backgrounds are less likely to seek medical help and resources just due to a lack of confidence in their ability to understand how to manage this difficult period in their lives. The thing is, every woman will go through this experience in the future. There's a whole range of symptoms, and some people may get off quite lightly. But on the other side, some people can experience really debilitating symptoms. As I mentioned, my mum went through a whole host of symptoms because she had an induced menopause. In the focus groups, lots of different things were just coming up time and time again. I want to be acknowledged. I just want to be listened to.
We are the people to turn these stories into action. We are Liria Digital. Liria Digital is what you get when you get two incredibly passionate people who join the tech industry, not for the hardware, not for the software, not for the $1 billion valuation. Not going to turn that down when that happens, but because of a genuine desire to do tech for good. Liria Digital is what you get when you have an anthropologist who specialized in digital inclusion, but wanted to be more hands-on, joined the tech industry so that they could design tech that's more accessible and reach as many people as possible. So they became a software developer at the NHS. And then that person who wasn't able to quite shake people before technology became fascinated by how cyber criminals were utilizing behavioral science to make people engage in risky behavior, pivoted again, and then became a cybersecurity evangelist so that the data we share doesn't go in the wrong hands. Liria Digital is what you get when you've been working on the front line for 15 years as a pharmacist, developing a deep understanding about symptoms and conditions that can be sometimes too embarrassing to discuss. It's what you get when you see the dots connect with the data and the experiences that people are going through in a way that nobody else seems to do. It's what you get when you have someone that really cares, but more than that, has the drive, the ambition to see it through. Liria Digital is what you get when two people come together after looking at what's already out there and going, there must be a better way. We're not going to wait for Silicon Valley to build something that doesn't meet our needs. We demand better, you should demand better, and we will help you create better. Liria Digital cares so much about the person that we are so invested that it's you over the technology, that we will design our products, unlike every other technology product that's out there, to be non-addictive. If your phone is in your pocket more than your hand to help you with your health and well-being, then we've done our job. We want our innovations to be able to enable you to enjoy living your life in that moment. Our health products are not a tool. Our health products are a tool, not a lifestyle.
We have grand ambitions. We envisage our innovations in the form of products and services to be available and accessible to the people that really need them. Our innovations will simply make our customers' lives better. We're an international company. This is reflected by the diverse panel we have from all over the world for this here today.
So what do we need from you? Well, we're looking to expand the team. We're in the process of creating a pilot study, and this will put our technology in the hands of about 50,000 women to start with. And then that will hopefully spread across England, and then we'll move it to international markets. We are moving very fast, and we need to grow very fast. We'll be advertising these roles formally, but in the meantime, if you want to find us on LinkedIn, get in touch and we'll happily hear your story. We're also looking to fund our minimum viable product, which is the menopause app that we've been discussing. As I say, we've had loads of interest from women, but also from other clinicians and other people in health tech who want this product to come to market. Our commissioners are waiting for us to deliver. With investment, we will deliver.
We need more research. We need more stories. We need your stories. You support us by coming to this launch, and we're so thankful and grateful for that. You're already on that journey with us. The time is now. We are the people to bring about this revolution. Join us. We need you. We are here to disrupt the health tech industry.
We are here to change the world. Liria Digital Health. Demand better. Thank you for joining us.
Thank you.